Hi, I'm Jessica Mannion with My Healthcare Direct, and today I'm going to guide you through the essential steps on how to enroll in Medicare. Whether you're turning 65 or you're eligible due to certain circumstances, understanding the enrollment process is crucial for accessing your healthcare benefits that you deserve. So let's dive in. Before we get started, make sure you hit the subscribe button and ring the notification bell so that you'll never miss out on our valuable healthcare tips and advice. Before we get into discussing how to enroll in Medicare, let's go over some of the basics. Medicare is a national health insurance program that is primarily designed for individuals who are ages 65 and older. Now, there are a few exceptions to those under 65 who are eligible for Medicare, such as those being on disability or those with terminal illnesses such as end-stage renal disease. Medicare is made up of two main parts: Part A, which is your hospitalization coverage, and Part B, which is your medical coverage. For those of you who are currently taking Social Security before turning 65, you will automatically be enrolled in Parts A and B. Therefore, you should receive your red, white, and blue Medicare card up to 3 months before the month you turn 65. Your effective dates for Part A and Part B will be the first of the month that you turn 65 if you were enrolled previously. For those of you on Social Security and are auto-enrolled in Medicare, your effective dates for Part A and Part B will be the first of the month of your birthday. Now, your effective dates will be the first of the month that you turn 65. However, those of you who are born on the first of the month, your effective date will actually be the month before. So, for example, if you were born on April 1st, your effective date for Medicare would be March 1st. If you are not drawing from Social Security benefits up to 4 months before turning 65, then you will have to self-enroll in Medicare during your initial enrollment period. This period begins up to 3 months before you turn 65, the month you turn 65, and up to 3 months after you turn 65, for a total of a 7-month period. If you are able to enroll before your birth month, your effective dates for Part A and Part B should be the first of the month you were born. If you enroll in Medicare after your birth month, your Part B coverage can be delayed, and depending upon how soon after your birthday you enroll, your Medicare coverage could be delayed. There are 3 main ways to enroll in Medicare. The first is by going into your local Social Security office and enrolling in person. The second is by calling Social Security and enrolling over the telephone. But if you've ever tried calling Social Security, especially on the national number, you know, depending upon the time of day, it could be very difficult to get someone on the phone. So the most popular and probably easiest option is by enrolling online. And I'm going to walk you through the process on how to get started. The first thing you're going to do to enroll in Medicare is you're going to go to the website ssa.gov. It should take you to this home screen where you're going to look for the section that says Apply. The second link down should say Sign Up for Medicare, and that's what you're going to want to select. From here, it's going to take you to the page where you're going to begin the process. So if you are someone who is turning 65 and you need to enroll on Part A and Part B, you're going to want to click the Apply Online button under Sign Up for Medicare. If you are someone who is already older than 65 and you're enrolled in Part A, but you delayed your Part B and you need to enroll for just Part B, you're going to select the Get Started button under the Sign Up for Part B Only section. But for the sake of this example, we're going to say we're turning 65 and need to enroll in both Parts A and B. So we're going to select Apply Online. From here, it's going to take you to the Terms and Service page. Feel free to read this over. And then once you're done reading it over, you're going to want to select the box that says I understand and agree to the above statements and select Next. From here, you're going to scroll down to the Apply and Complete section. If you have already started this application process and you have not completed it, you can return to your saved application, or you can start a new application if you have not begun yet. So for this example, we're going to say we have not started an application, so we're going to click Start a New Application. Now it's going to ask us a few questions. The first one is you're going to want to say that you are applying for yourself. Then it's going to prompt you to see if you have a My Social Security account. Now, if you do not currently have an account, you're going to want to select No, and then it's going to prompt you for one more question, asking if you have an address in the United States, which you will select Yes. If you do have a My Social Security account, you'll want to select yes, and that other question goes away and you'll hit next. So let's say for this example that you don't have a Social Security account, but you do have an address in the US, so you'll hit next. Both options are going to take you right to this page. Now, if you have created an account before and you created it before September 18th, 2021, you're going to sign in using your Social Security username. Otherwise, you're going to log in using one of these two options. If you have not created a Social Security account, you still would use one of these links to create an account. Now, if I had an account, I would go ahead and type in my email address and password and sign in. Or you can create an account by typing in the email address you would like to use, selecting your language preference, and selecting the little box that says I read and accept the login.gov rules of use and hit submit. Once you have submitted your application, you will receive a confirmation from Social Security that they have received the application. Once it has been processed, they will send you a letter in the mail, followed by your red, white, and blue card soon after. If you have any more questions on the Medicare enrollment process, what options you have once you are enrolled in Medicare Parts A and B, please feel free to give our office a call at 888-959-1028, or you can reach us by email at info@myhealthcaredirect.com.